Hi, Dr. Riaz Agha at Harley Clinic on Harley Street. I wanted to talk to you about complications after an operation and how I manage them. In general terms, the kinds of complications that you get, they could either be sort of general complications like bleeding, infection, pain, swelling, poor wound healing, bruising, irritation of a nerve or nerve injury or damage to any other structure, the sort of general complications that you could get. You should also include in that for longer operations like deep vein thrombosis or pulmonary embolisms, so clots in the legs that can travel to your lungs, cause difficulty with breathing. Very rare, but they can happen. So general complications versus sort of specific complications to do with the very particular procedure that you're having. So they may be implant-based complications, for instance, if you're having a breast implant. So they could be exposure or extrusion of the implant, rupture of the implant, which is about 1% a year, but some manufacturers would have more specific figures on that, but generally I quote 1% a year. 10% at 10 years for capsular contracture is the sort of general figure that I go by. The average lifespan of an implant is about 12 years or so. That doesn't mean you have to change it at 12 years, it can keep it for longer, but often people have an issue at that time or thereabouts with either a rupture, a capsular contracture or a sizing issue, or they want to have a reshaping or so on. The other thing to think about is breast implant illness and BIA-ALCL, breast implant associated anaplastic large cell lymphoma. So those are the more rare kind of conditions. So BIA-ALCL is 1 in 20,000. Breast implant illness, we're not really sure how frequent it is, but it is something that is increasingly in our understanding. So those are the sort of general and sort of specific complications, as well as, with implants, malposition or rippling or implant edge visibility, bottoming out, water falling, double bubble, all of these kinds of things can occur, for instance, with breast implants. In terms of how I manage complications, well, it really depends on what it is. So if you've got something like bruising, generally that improves with time. Swelling improves with time. Pain, you need to treat with, obviously painkillers. That's inevitable that there will be a stimulus of pain, but it needs to be well controlled with painkillers so people can have a nice, smooth and post-operative experience. In terms of bleeding, if bleeding occurs, well, you may get some ooze at some of the operative sites, but generally that can be absorbed by the dressings. If there's significant bleeding that's not being controlled, then one needs to get control of it. That may necessitate a return to theatre, which is extremely rare. There may be a collection of blood that's built up that needs to be drained. That can be drained with a needle and syringe in the clinic, or it can be go back to theatre for a proper evacuation. In terms of infection, that needs to be treated with antibiotics. That can be orally or through a drip if it's very severe. Good sort of wound care helps to treat a lot of infections, so that's how you treat infection. We try and prevent deep vein thrombosis and pulmonary embolism. Those are the stockings that people wear for at least a week after surgery. For the longer operations, they would have blood thinning injections. So for instance, a tummy tuck, they'll have blood thinning injections for a week at the same time each day, and that helps to reduce the risk of that. During the actual surgery, they'll have pumps on the legs that can help to what we call Flowtron boots that help to keep the circulation going. So the best treatment of that is really try and prevent it in the first instance, because it's a severe complication. But obviously if it does happen, then people need to be on blood thinners, and we'll be consulting a hematologist and so on for that, and they may need to stay in hospital. Those are the kinds of major complications that can occur, the most frequent ones. In terms of rippling and edge visibility and implant-based complications, it depends on what it is, and sometimes that may necessitate removing the implant or exchanging the implant or doing some other procedure to treat that kind of complication, depending on what it is.